The emergency room fell silent as Dr. Brandon Hayes mocked the woman clutching her chest in pain. He called her dramatic, accused her of wasting his time, and demanded she leave. But when the double doors burst open moments later, the surgeon's face went pale. He had no idea who she really was. Before we dive into this story, if you believe respect costs nothing but means everything, hit that subscribe button. You won't want to miss how this unfolds. Now let's begin. It was a typical Thursday evening at Metropolitan Hospital, the kind of night where the emergency room hummed with controlled chaos. Nurses moved briskly between patients, monitors beeped in steady rhythms, and the fluorescent lights cast their harsh glow over everyone who passed through those doors. In the corner of the waiting area, Margaret Walsh sat quietly, her hands folded in her lap, trying not to draw attention to herself. Margaret was 48 years old, though the lines around her eyes might have suggested a few more years. They weren't lines of age so much as lines of experience, the kind that come from worry and sacrifice and countless sleepless nights. She wore simple clothes that evening, a pair of well-worn jeans, a navy blue sweater that had seen better days, and practical shoes. Her wedding ring, a simple gold band, was the only jewelry she wore. There was nothing about her appearance that demanded attention or suggested importance. She looked exactly like what she was, an ordinary woman, a housewife, a mother, the kind of person who could blend into any crowd and disappear without notice. She had come to the hospital that evening to bring her elderly mother for a routine checkup. The appointment had gone fine, and her mother was now being processed for discharge. Margaret had been sitting in the waiting area, leafing through an outdated magazine, when she first felt it, a tightness in her chest. Nothing dramatic at first, just a subtle pressure that made her shift uncomfortably in the plastic chair. She rubbed her breastbone absently, thinking perhaps she had eaten something that disagreed with her. But the pressure didn't fade. Instead, it grew stronger, spreading across her chest like a heavy weight, pressing down on her rib cage. Margaret set down the magazine, her breathing becoming shallow. Beads of sweat formed on her forehead despite the cool air conditioning. Her left arm began to ache, a dull throbbing that radiated down to her fingertips. She knew these symptoms. She had read about them, heard about them, seen them discussed on medical shows. But surely not her. Not now. Margaret stood up slowly, gripping the armrest of the chair for support. The room tilted slightly, and she had to close her eyes for a moment to steady herself. When she opened them again, the pain had intensified. It felt like someone had wrapped a steel band around her chest and was slowly tightening it, squeezing the air from her lungs. She made her way to the nurse's station, each step requiring conscious effort. A young nurse named Katie looked up from her computer screen as Margaret approached. Katie saw a middle-aged woman in plain clothes, nothing that screamed emergency, nothing that suggested urgency. The ER was busy tonight, and there were patients who looked far worse. Margaret leaned against the counter, her voice quiet and apologetic. "Excuse me," she said softly. "I'm not sure, but I think something might be wrong. I'm having chest pain." Katie glanced at her briefly, typing something into her computer. "Have you checked in? Are you registered?" "No, I was just waiting for my mother. But the pain, it's getting worse." The nurse looked at Margaret more carefully now, noting the pale complexion and the slight tremor in her hands. "Okay, let me get someone to look at you. Can you sit down over there?" Margaret nodded and made her way to a nearby chair, sinking into it gratefully. The pain was relentless now, a crushing sensation that made it difficult to think about anything else. She pressed her hand against her chest, trying to ease the pressure, but nothing helped around her. Life in the emergency room continued. Nurses called out orders. Patients groaned. Machines beeped. She felt invisible, just another face in the crowd. 20 minutes passed, then 30. Margaret's condition worsened with each passing moment. Her breathing became more labored, her skin clammy with sweat. She wanted to call out, to demand help, but she had been raised to be polite, to not make a fuss, to wait her turn. Besides, there were people here who looked like they needed help more urgently. A man with a bleeding head wound, a child crying with what looked like a broken arm. Surely they took priority. Finally, Katie approached with a doctor in tow. Dr. Brandon Hayes was a man who commanded attention when he entered a room, though not always for the right reasons. At 42, he was at the peak of his career, a cardiac surgeon with an impressive list of credentials and successful operations behind him. He had just finished a complex procedure on the family member of a wealthy businessman, and he was tired, irritable, and not particularly interested in dealing with what he assumed would be another case of someone overreacting to minor discomfort. Dr. Hayes looked at Margaret with barely concealed impatience. He saw what everyone else saw, a woman in plain clothes, no insurance bracelet, no visible signs of wealth or status. In his experience, people like this often came to the ER for problems that could be handled by a regular doctor, wasting valuable resources and his valuable time. "What seems to be the problem?" he asked, his tone professional but cold. Margaret tried to explain, her voice strained. "I have this pain in my chest. It's really tight, and my arm hurts, and I feel like I can't breathe properly." Dr. Hayes performed a cursory examination, barely touching her. He checked her pulse with obvious disinterest, listened to her heart for perhaps 10 seconds, and stepped back. "Your vitals are stable. When did this start?" "About 45 minutes ago. It keeps getting worse." He sighed, the sound heavy with judgment. "Have you been under stress lately? Anxiety can cause chest pain. You know, a lot of people mistake panic attacks for heart problems." Margaret shook her head weakly. "I don't think this is anxiety. It feels different. It feels serious." Dr. Hayes crossed his arms, his expression hardening. "Mrs. What's your name?" "Walsh. Margaret Walsh." "Mrs. Walsh, this is an emergency room. We deal with actual emergencies here. Heart attacks, strokes, traumatic injuries. You're probably just experiencing some indigestion or stress. Maybe you've been watching too many medical dramas on television." His words carried a mocking edge that made several nearby patients glance over. Margaret felt her face flush with humiliation. She tried to speak, to insist that something was genuinely wrong, but Dr. Hayes cut her off. "Look, I've been doing this for 20 years. I know what a real cardiac event looks like, and this isn't it. You're wasting resources that could be used for people who actually need them. My advice? Go home, take some antacids, maybe see a therapist about managing your anxiety. The ER is not a spa where you come for attention every time you feel a little uncomfortable." The words hung in the air like poison. Other patients stared. Nurses shifted uncomfortably but said nothing. In the hierarchy of a hospital, surgeons like Dr. Hayes held enormous power, and few people were willing to challenge them. Margaret felt tears sting her eyes, a mixture of pain, fear, and profound humiliation. She had asked for help, described her symptoms honestly, and been dismissed as a nuisance, a drama queen seeking attention. Dr. Hayes turned to leave, his white coat billowing behind him. "Nurse, please show Mrs. Walsh to the exit. And next time," he said, looking back at Margaret with thinly veiled contempt, "consider whether your problem is really worth bothering emergency medical professionals." Margaret tried to stand, her legs shaking. The room spun around her, and she gripped the chair for support. The pain in her chest had become almost unbearable, radiating through her entire torso. But what hurt even more was the shame, the feeling that she had done something wrong by asking for help, that she wasn't important enough, wasn't worth enough to deserve proper medical attention. She managed to walk a few steps before having to sit down again, this time in a chair near the exit. Her vision blurred. Her heart hammered erratically in her chest, each beat a painful reminder that something was very, very wrong. But Dr. Hayes had spoken. The expert had made his judgment. Who was she to argue? That's when the double doors of the emergency room burst open with a force that made everyone turn. The man who strode through them had the bearing of someone accustomed to command, someone who had spent decades making decisions that affected lives. Colonel Thomas Walsh was 52 years old, with steel gray hair cut in a military style, and eyes that could assess a situation in seconds. He wore his dress uniform, having come directly from a meeting at the Pentagon, the ribbons and insignia on his chest telling the story of 3 decades of distinguished service to his country. Thomas's eyes scanned the room with practiced efficiency, searching for one person. When he spotted Margaret slumped in the chair by the exit, her face ashen and her breathing shallow, His expression shifted from concern to barely controlled fury. He crossed the room in long strides, dropping to his knees beside his wife. "Margaret," he said, his voice gentle despite the fear he felt. "I'm here. Tell me what's happening." She looked at him with eyes full of pain and relief. "Thomas, I don't feel well. The doctor said I'm fine, but—" He took her hand, feeling her rapid, irregular pulse. His military training included extensive medical knowledge, enough to recognize the signs that any competent doctor should have seen immediately: cold, clammy skin, rapid heart rate, pain radiating down the left arm, shortness of breath. These weren't symptoms of anxiety or indigestion. These were textbook signs of a cardiac event. Thomas stood up, his voice cutting through the noise of the emergency room like a blade. "I need a doctor here now." The authority in his tone made people snap to attention. Nurse Katie hurried over, suddenly seeing Margaret's condition with fresh eyes. "Sir, we had a doctor examine her. He said—" "I don't care what he said. My wife is having a heart attack. She needs treatment immediately." Dr. Hayes, hearing the commotion, returned with an irritated expression that faltered the moment he saw Colonel Walsh. The uniform was impossible to miss, the rank insignia even more so. This wasn't just anyone. This was a senior military officer, someone who wielded real authority, someone who could make serious problems for anyone who had failed in their duty. "Is there a problem here?" Dr. Hayes asked, trying to maintain his professional composure. Thomas turned to face him, and the look in his eyes could have frozen fire. "Are you the doctor who examined my wife?" "I am, and I assessed that her symptoms were likely related to anxiety or—" "You assessed wrong." Thomas's voice was quiet now, but that made it more dangerous, not less. "My wife is experiencing an acute cardiac event. Anyone with basic medical training can see that." "How long has she been here?" Dr. Hayes felt the first stirrings of real fear. I examined her about 15 minutes ago. Her vitals were stable." "Stable doesn't mean normal. Stable doesn't mean safe. Did you run an EKG? Did you check her cardiac enzymes? Did you do anything beyond the most cursory examination?" The silence that followed was damning. Dr. Hayes had done none of those things. He had looked at Margaret, judged her by her appearance, made assumptions about who she was and what she deserved, and sent her away. Around them, other medical staff had gathered, recognizing the severity of the situation. Thomas continued, his voice steady but filled with cold anger. "I want an EKG immediately. I want a full cardiac workup. And I want someone competent treating my wife now." Within minutes, Margaret was surrounded by medical personnel. A different doctor, Dr. Frank Morrison, took charge. He was older, more experienced, and his face grew grave as he reviewed Margaret's symptoms and performed a proper examination. An EKG machine was wheeled over, electrodes attached to Margaret's chest. The rhythmic beeping filled the air as the machine recorded the electrical activity of her heart. Dr. Morrison studied the readout, and his expression confirmed Thomas's worst fears. "Mrs. Walsh, you're having a heart attack. We need to get you to the cardiac unit immediately." The words sent a ripple of shock through the gathered staff. Dr. Hayes stood frozen, the color draining from his face as he realized the magnitude of his mistake. He had dismissed a woman having an active heart attack. He had mocked her, humiliated her, and sent her away. If her husband hadn't arrived when he did, if another 10 or 15 minutes had passed, Margaret Walsh might have died in that waiting room chair, and her blood would have been on his hands. Margaret was rushed away on a gurney, Thomas walking briskly beside her, holding her hand. As they disappeared through the doors leading to the cardiac unit, Dr. Hayes remained standing in the emergency room, surrounded by staff members who now looked at him with a mixture of shock and disgust. He had committed one of medicine's most fundamental failures. He had let his prejudices override his professional judgment. Within the hour, the hospital administrator, Dr. Helen Foster, was reviewing security footage and witness statements. What she found was damning. The cameras had captured Dr. Hayes's dismissive treatment of Margaret, his mocking tone, his complete failure to perform adequate diagnostic procedures. Nurses came forward with statements. Other patients who had witnessed the interaction provided their accounts. And as the investigation deepened, a pattern emerged. This wasn't an isolated incident. Dr. Hayes had a history of treating patients differently based on their apparent socioeconomic status. Wealthy patients received his full attention and expertise. Others, like Margaret, were dismissed as nuisances. The investigation also revealed who Margaret Walsh really was. Not a woman of wealth or fame, but someone whose quiet service and sacrifice had earned respect in circles that mattered. For 25 years, she had been a military wife, raising two children largely alone while her husband served overseas in dangerous assignments. She had moved 17 times, each time rebuilding her life, making new friends, finding new ways to contribute to her community. When Thomas was deployed to war zones, she had held their family together, attending school events alone, celebrating holidays with an empty chair at the table, and never once complaining about the sacrifices required of her. Margaret had volunteered countless hours at VA hospitals, sitting with wounded veterans, reading to those who couldn't see, writing letters for those who couldn't hold a pen. She had organized support groups for military spouses, helping others navigate the unique challenges of military life. She had raised money for scholarships for children of fallen soldiers. Her work had been recognized by Congress, though she had never sought recognition. She did it because it was right, because these were her people, her community, and they deserved support. But none of that had been visible to Dr. Hayes when he looked at her. He had seen only a simply dressed woman without the markers of importance he had been trained to recognize. No expensive jewelry, no designer clothes, no demanding attitude that suggested money and connections. Just an ordinary woman asking for help. And in his arrogance, he had decided she wasn't worth his time. In the cardiac unit, Dr. Morrison worked quickly to stabilize Margaret. The heart attack was real, the damage concerning but not catastrophic. With proper treatment, she would recover. But it had been close. Another 20 minutes without intervention could have resulted in severe permanent heart damage or death. Thomas sat in the waiting room, his hands clasped together, his usual composure cracked by fear for the woman he had loved for 30 years. When Dr. Morrison emerged to update him, the news was cautiously optimistic. "She's stable. We've placed a stent to open the blocked artery. She'll need time to recover, but she should be fine." Thomas closed his eyes briefly, relief washing over him. "Thank you, doctor. Thank you for actually looking at her, for seeing what needed to be seen." Dr. Morrison's expression was somber. "I'm sorry for what happened downstairs. There's no excuse for it. Your wife deserved better. Every patient deserves better." The consequences for Dr. Hayes came swiftly. The hospital board convened an emergency meeting. The evidence was overwhelming, and the liability enormous. Dr. Hayes was suspended pending a full investigation. He was required to undergo retraining on patient care, bias recognition, and professional ethics. His reputation in the medical community, once stellar, was now tarnished. Word spread quickly among his colleagues about what he had done, and many who had once respected him now questioned his judgment and character. But perhaps the hardest moment for Dr. Hayes came 3 days later, when Margaret was moved out of the cardiac intensive care unit to a regular room. He stood outside her door for a long time, trying to find the courage to enter. Finally, he knocked softly. Thomas opened the door, his expression hardening when he saw who it was. But Margaret, propped up in bed with monitors still beeping around her, said quietly, "It's okay. Let him in." Dr. Hayes stepped inside, and for the first time in his career, he looked truly humbled. "Mrs. Walsh, I came to apologize. What I did was inexcusable. I made judgments about you based on your appearance. I let my prejudices override my medical training. I nearly cost you your life, and I will have to live with that for the rest of mine." Margaret looked at him with eyes that held no hatred, only a deep sadness. "Do you know what hurt most, doctor? It wasn't the physical pain, though that was terrible. It was feeling invisible, feeling like I didn't matter enough to be seen, to be heard, to be believed. I spent my whole life trying to be a good person, trying to help others, trying to make a difference in small ways. But in your eyes, I was nothing, just a nuisance taking up space." Her words cut deeper than any rebuke. Dr. Hayes felt shame wash over him in waves. "You're right. I'm so very sorry." Thomas stepped forward. My wife is one of the strongest people I've ever known. She's raised our children through deployments and dangers I can't even tell you about. She's held the hands of dying veterans and comforted their families. She's organized communities and changed lives. She's done all of this without seeking recognition or reward, and you judged her worth by her clothing. Dr. Hayes had no defense, no excuse. He looked at Margaret, this woman he had so badly wronged, and said the only thing he could. I will do better, I will be better, I promise you that. Margaret nodded slowly. Everyone deserves a second chance, doctor, just like I got mine. When you walk back into that emergency room, I hope you'll remember that every person who comes through those doors is someone's wife, someone's husband, someone's child. They all have stories, they all have value, and they all deserve to be seen. 1 month later, Margaret returned to the hospital for a follow-up appointment. She was recovering well, her heart healing, her strength returning. As she walked through the emergency room with Thomas by her side, she saw Dr. Hayes. He was with a patient, an elderly homeless man who had come in with chest pains. But this time, Dr. Hayes wasn't dismissive. He was attentive, thorough, treating the man with the same care and respect he would give to anyone, regardless of their station in life. When he saw Margaret, he approached her hesitantly. Mrs. Walsh, it's good to see you looking well. She smiled. Thank you, doctor. I see you're doing good work. I'm trying. Your words changed something in me. Changed everything, really. I've requested to work more shifts in the ER, and I'm volunteering at the free clinic downtown. I want to be the kind of doctor I should have been all along. Margaret reached out and touched his arm briefly. That's all any of us can do. Keep trying to be better than we were yesterday. As she and Thomas left the hospital, walking out into the bright sunshine, he squeezed her hand. You know, you could have destroyed him. You had every right to be angry, to demand more severe consequences. Margaret shook her head. Anger doesn't heal anything, Thomas. Besides, I'm just a simple woman who knows one truth. We're all human, we all make mistakes, and we all deserve the chance to learn from them. That doctor will save lives now. He'll see people differently. Maybe what happened to me will prevent the same thing from happening to someone else. That's worth more than revenge. They walked to their car, a modest sedan that had seen many miles. Margaret looked back at the hospital one more time. Somewhere in there, lessons were being learned, policies were being changed, and people were being reminded of the most basic principle of medicine. First, do no harm, but also see the humanity in every patient. Recognize that worth isn't measured by wealth or status, but by the simple fact of being human. She was a simple woman, yes, but she had taught a powerful man a lesson he would never forget. And in doing so, she had reminded everyone who heard her story of a truth that should never need repeating but often does. Every person deserves respect, dignity, and the basic decency of being seen for who they truly are. Margaret's story reminds us that every person deserves respect, regardless of how they look or where they come from. A simple woman, a military wife, a mother. She was all of these, and she was enough. If this story touched your heart, please like this video and share it with someone who needs to hear it. Subscribe for more stories that remind us of our shared humanity. And remember, never judge someone by their appearance. You never know what battles they fought or what strength they carry. See you in the next story.